Hi, this is Priyanka Chopra and you're watching Channel Y.
The biggest South Asian media group, Y Media. Y Media has newspaper, midweek, radio, South Asian Pulse.
Hi, I'm Amitabh Bachchan and you're listening to South Asian Pulse.
Hi, this is Amir Khan and you're listening to South Asian Pulse.
अब हर दिन सुने GTA का #1 रेडियो स्टेशन FM 91.9.
You are watching Channel Y. Channel Y.
Prime Minister, welcome.
It's a pleasure to be here. It's a pleasure to be back.
Online, SouthAsianDaily.com. The biggest South Asian media group, Y Media.
North with us. Hello, sir. How are you?
Hey, good morning, Yazbir. I'm doing very well. Thank you for having me on the show.
You are very welcome, a very warm welcome on behalf of Y Media. And I know the Premier did an announcement on the offloading some of the work because of the backlog. What are the details for that?
Yeah, so one of the things that we heard throughout the last few years is that the status quo in the healthcare system simply isn't working. And we know the Ontario government's been spending record levels of money on hospital care, on long-term care, on staffing. We're pouring more money into the problem, but we're still not receiving the outcomes that we like. So what the Premier announced yesterday was an intention to do a bit of a pivot and try something new. So specifically what we're looking to do is move some of the other healthcare procedures into community-based clinics and out of the hospital. So we're starting with it's a 3-step plan. The first step of it, right away, we're going to be having 14,000 more cataract surgeries, which represents about 25% of the wait list. And we're also going to be allowing 49,000 combined hours of MRI and CT scans out of existing community clinics. Step 2 is to look at expanding that scope. So really building out that system where we have more in-community healthcare providers. And then on step 3, we're going to be looking at actually knee and hip replacements, adding those surgeries into it as well. Now, the problem is that when somebody goes to the hospital for one of these procedures, they're in the same waiting room as somebody that's in the hospital for maybe a more serious procedure. So what we're looking to do is make sure that you and your family are able to get the right health care at the right place, and we hope that we build better outcomes for patients in Ontario.
All right, seems like a plan, but there are a few questions as well. One of them is, are we looking at more cost when we are getting the private clinics involved?
So the government's been invested an $18 million investment into the upgraded procedures, but I want to be clear because there is a lot of misinformation out there. What we're looking at is to allow these clinics to use more OHIP services. So there's never going to be a case in Ontario where somebody has to use their credit card to pay for healthcare. They will always have to use their OHIP card to pay for healthcare in Ontario. So all of these services are in public, government-funded procedures. There's no special wait line that you can get if you pay more money or anything like that. This is all OHIP procedures. What we're just doing is expanding the amount of people that are able to provide these OHIP covered procedures.
All right. So and anyone going there, they'll just use their OHIP cards. So not a cost directly for any of the users. But will the government pay more? I mean, imagine if the same procedure, any of these procedures were done at a public hospital, and now if that procedure is done at a private hospital, will the government be paying more? Any extra dollars for the government?
No, and actually in some cases paying less. So the OHIP codes are standardized. So, if it's a cataract surgery, there's a cost that the institution, whether it's a hospital or whether it's now one of these community clinics, there's a cost that they bill to the Ontario Health Insurance Plan, OHIP, that they recover for that procedure. But on the flip side, actually for a lot of these community clinics, it's actually a cost for the building that the government won't have to pick up. When we build a hospital, that's public money that goes into funding these buildings. And of course, I just want to be clear, we are building hospitals too. We have a second hospital going into Brampton with Peel Memorial. We have the big Trillium hospital going in Mississauga. So we're still investing in kind of the brick and mortar hospitals, medical schools, all that kind of thing. But we're also expanding the service with some of these community clinics that we really think, at the end of the day, it's about what's going to be the best outcome for the patient. And, if we can divert some of these patients out of the hospital, out into community where they can receive the same level of care, we think that's going to be good for the hospital surgical backlog that we're facing.
All right. And one more concern is that obviously, there's staff shortage at public hospitals. So unless we have some new healthcare service providers, if we are planning to streamline, which we've been talking for quite some time, the internationally foreign-trained, healthcare professionals, then we're still going to see staff shortages.
Well, so we've been, the health human resource problem has been really plaguing us even since before COVID, but got exacerbated during COVID. But exactly the concern is that you've talked about is informing the approach that we're taking. So with step one, which is kind of in the immediate, we're only expanding the amount of services that can be provided by existing clinics using existing resources. Now, as we move on to step 2 and 3, we're going to be working with hospitals and Ontario Health to make sure that resources are allocated effectively. For instance, new facilities are going to be required to provide staffing proposals as part of their application. And a number of physicians will be required to actively work at their local hospital as well. So, the intention of the program that we're rolling out is not to kind of put healthcare providers against each other, so they're competing for staff and all that kind of thing. What we're actually looking to do is expand the availability of some of the world-class services that, frankly, people rightly expect and people rightly deserve.
All right. And my last thing is that do we have any references that this kind of system has worked anywhere else in any province in Canada or any other provinces in Europe or even states for that matter?
Yeah, so it's actually not new. What we're looking to roll out, they're doing similar things in British Columbia. There's similar things happening in Quebec right now. Saskatchewan did a similar thing. So we're really, we wanted to make sure, obviously, that we don't go out on a limb and kind of experiment unnecessarily. We've seen proof points that very good outcomes can derive from some of the changes that we've been making. And, again, we're going to be continuing to monitor as these changes roll out. Our priority, the priority of the Ford government, is always the best outcome for the patient. And that's what's really going to be guiding us as we continue to see how this program works.
All right. Before I let you go, since I have you online with me, you're from a specific question for Brampton, and you being the MPP for Brampton North. We see one of the busiest hospitals there in your own riding, and there have been questions raised. When are we going to get at least 2 more hospitals? That's what they're looking at, but we don't even have another full-fledged 24/7 hospital. What's your take on this one?
Yeah, well, Minupata, Tonupata, Saranupata, one of the biggest promises that we made during the last campaign was a commitment around getting Peel Memorial open. So Peel Memorial at the site of Queen and Centre Street, This was an old hospital, actually one that I was born in, that was closed by the Liberal government in 2007. We're bringing it back online, and we're looking to have it open over the next couple of years. Third hospital is something I hear about from lots of residents. My priority right now is to make sure we get our second hospital open on time, on budget. Complementing that obviously is the Toronto Metropolitan University Medical School, where we're going to be able to have Brampton students become Brampton medical students and eventually become Brampton doctors. And there's some good news that we're looking to be announcing about that very shortly. So, I want to assure Brampton residents that these local priorities around expanding healthcare are the number one priority for myself and for my other Brampton colleagues. And we're working tirelessly to deliver results for the community. And, we're working for you, and we're looking forward to getting that done.
All right. Thank you so much for all the time, and we certainly look forward to having more discussions when you come to our Channel Y. This was MPP Graham McGraw, MPP for Brampton North. Thank you so much, and anything else you want to add before I let you go?
No, just wishing a Happy New Year to you and your audience. Thank you, Yadveer, for having me on, and thank you to all your viewers and your listeners for hearing me out today.
Graham, Happy New Year to you and your entire team as well. Wishing you all the best. Talk to you soon. Thank you so much for your time once again.
Thank you, sir. Take care.
Thank you. Take care. Bye-bye.
Hi, this is Priyanka Chopra and you're watching Channel Y.
The biggest South Asian media group, Y Media. Y Media has newspaper, midweek, radio, South Asian Pulse.
Hi, I'm Amitabh Bachchan, and you're listening to South Asian Pulse.
Hi, this is Amir Khan and you're listening to South Asian Pulse.
अब हर दिन सुने GTA का नंबर 1 रेडियो स्टेशन FM 91.9.
You are watching Channel Y. Channel Y.
Prime Minister, welcome. It's a pleasure to be here. It's a pleasure to be back.
Online, SouthAsianDaily.com. The biggest South Asian media group, Y Media.